Bismillahirrahmanirrahim. Hello and welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. I hope all of you are well and fine. Dear friends, today I am going to explain another lecture that is related to the hormone, and it is about the oxytocin hormone. If you guys remember, we already talked to different hormones, like we have talked FSH, LH, prolactin, thyroid hormones, growth hormones, and some other types of the hormones as well. Now this is another video lecture that is related to the hormone, and it is about the oxytocin blood test. So my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Now let's explain this topic. Okay. Viewers, first of all, let's see that what is actually oxytocin hormone. Oxytocin hormone is also called as love hormone, and it is also called as bonding hormone as well. Now this type of the hormone is mostly secreted in the female, okay, and it is the most important hormone of the female as well. In the female, it is mostly produced from the hypothalamus area that is present into the brain, as well as it is also secreted from the posterior part of the pituitary gland, okay, in a large amount. Now their less amount is also secreted from the ovaries. In male, it is produced from the testes. During pregnancy, it is produced from the placenta, as well as it is produced from the heart as well. So but when the hormone is released from this organ, it is produced in a very less amount, okay. Now this is the short introduction related to the oxytocin hormone. Now let's see that what is the main function of this hormone. The first main function of this hormone is that the first function is that it can reduce the anxiety problem. Second is that it is also help in to produce the milk during breastfeeding. It is also helpful to stimulate the uterine contraction during childbirth. Next, that it can relieve the pain when there is a pain, so this hormone will be secreted and relieve the pain. Next, that this type of the hormone can promote the social bonding as well as the attachment as well. Next, we have that this type of the hormone is also involved in memory as well as in the learning ability as well. Remember guys that this type of the hormone are also secreted when there is a physical touch. When there is a physical touch, so that type of the hormone is also secreted. Next, we have that this type of the hormone can also reduce the stress condition. Now this is the function of the oxytocin hormone. Now let's see that what is the diagnostic purpose of this test. So mostly the doctor recommend this test to just check the overall condition of the features, either the features in a healthy condition or in a if there is a complication. So what type of the condition of the features, so the doctor mostly recommend this type of the test. Moreover, this test is also recommended to just diagnose the placenta dysfunction, okay. This test is also recommended to see the level of the oxytocin. If the level is high or low. If the level is high, we call that condition hyperoxytocynism. If the level is low, so we call it hypoxytocinism, okay. Now this is about the diagnostic purpose. This type of the test is also used to check the treatment efficacy, either the treatment is workable or no. If let's suppose there is a hypo or hyperoxytocinism, and if we are providing a type of medicine to solve that type of the problem, so then the doctor must recommend this test that either the treatment is workable or not. Next, that what is the procedure of this test, how to perform this test. So it's very simple. First of all, what will you do? You have to take the blood in a gel tube or in a red top, then you will centrifuge it to get the serum. Next, what will you do? Next is that you have to centrifuge it to get the serum, and then you will run this test on advanced fully automated machine, like we have Mendre, we have Meglomi, we have Selectra. So these are the advanced fully automated machine. You can also run this test using semi-automated machine that are based on FIA, means fluorescence amino assay, like we have FineCare, lophia, and digrade. Now let's see the normal range of this test. So the normal range is, in case of the non-pregnant woman, it is 1 to 5 picogram per ml. In case of the pregnant woman, it should be 50 to 300 picogram per ml. And in case of the male, although this is not the hormone of the male, but in case of the male, it should be less than 5 picogram per ml. Okay, so this is about the normal range. Now let's see that what are the main causes of high oxytocin. So the main causes of high oxytocin is during labor and childbirth, the oxytocin level will get high. During breastfeeding, it is due to the emotional bonding and social interaction. When there is a physical touch, during stress and emotional support, when the hormone is given injectable or orally. So due to this condition, the hormone may get high into the female blood. Now let's see the main condition through which the hormone get low into the female. So it is due to the depression, it is due to loneliness, it is due to the lack of social interaction. It is also due to the hypopituitarism, if there is low hormone from the pituitary gland. It is also due to the chronic stress in aging when the female get old. So at that condition, the oxytocin hormone also released in a less amount. And it is also due to the infertility issue. So dear viewers, this is all about the oxytocin blood test. Thank you so much for watching this video. I hope you understand, but if still you have question, you can write your question into comment. I will try my best to give you answer as soon as possible. So if you understand, best of luck. I hope you like this video. So please like this video, share this video, and subscribe the channel to get more interesting videos like that. Thank you so much for watching.